So today's podcast is about, do pets always need a culture before antibiotics? And here is what you should know. So have you ever wondered why a vet sometimes does not perform a culture before prescribing antibiotics for your pet's infection? Well, it is not always necessary, but here are key situations where it definitely helps. Stick around to find out why. Hi, I'm Dr. Poonum Wilkhu, a veterinary pharmacist and the founder of Fur Babies Botanicals, a pet skincare range. Today, we're diving into an important question that many pet owners have about infections and antibiotics. Do we always need a culture before prescribing them? Let's find out. A culture is a laboratory test, and it's used to identify specific bacteria or fungi that are causing an infection in your pet. Think of it as a detective tool. It's like sending a sample to the lab for a detailed investigation. The lab grows the bacteria in a special environment to see which types of antibiotics can kill them. This is especially helpful when we're not sure what is causing the infection or when it is resistant to standard treatments. So how does it work? Here is how it works. Your vet collects a sample from an infected area, whether it's urine, skin, pus, or blood. This sample is then placed in a culture medium where bacteria can grow. After a few days, the lab identifies the bacteria and then tests them against various antibiotics to see which one works best. This ensures that we use the right antibiotic to fight the infection most effectively. Some of you may have heard of the word cytology. Let me explain what cytology is. Cytology is another diagnostic test, but instead of growing bacteria like a culture, cytology looks directly at the cells under a microscope to identify any abnormal cells or infections like bacteria or yeast. It is a quicker process compared to cultures, and it can provide immediate results. So how does it work? To perform a cytology, your vet will take a sample, often through a swabbing or aspirating from an infected area, and he places it or she places it on a microscope slide. The lab then examines the sample. For any cells that indicate infection, like white blood cells, bacteria, or yeast. The test is great for identifying the presence of infections like skin infections, ear infections, or ear or eye discharge. However, it does not identify which specific bacteria is causing the problem, unlike a culture. So when would your vet use cytology? Cytology is often used when a quick diagnosis is needed, especially for common conditions like ear infections, skin rashes, or eye issues. It is also helpful for yeast overgrowth, which can occur with allergies or a compromised immune system. But then you're saying, we were talking about culture earlier, so when is a culture necessary? A culture is useful when there is an unresolved or recurrent infections. So if your pet's infection isn't responding to treatment, we may need to perform a culture. This helps us figure out if we're dealing with a tricky, stubborn bacteria that requires a different antibiotic, or if we're dealing with a complicated or a deep infection. In more serious infections like abscesses or bone infections, a culture can give us a clearer picture of the bacteria. This ensures that we choose the most effective treatment plan. What if your pet's infection is resistant to common antibiotics? Cultures can also help us identify this and target the bacteria with the right medicine. It is important that when infections are hard to treat and they keep coming back, that we do perform a culture. Sometimes a culture is useful when we don't know the source of infection. So in the cases where infection's origin is not clear, like with sepsis or systemic illness, a culture can be a game changer. This helps us identify the pathogen and then helps us allow to treat your pet more effectively. Are there different types of cultures? Yes. There is a bacterial culture, and this is the most common type. It is used to identify bacterial infections. And how do they take the samples? The samples are taken from either urine, depending if it's urinary tract infections, skin, blood, or other bodily fluids. Now, this culture will help us determine which antibiotic is going to be the most effective to treat the infection. Then we have the fungal culture. The fungal culture is used to identify, obviously, fungal infections like ringworm or yeast infections. This type of culture takes a bit longer to grow, and sometimes it can take up to 3 weeks because fungi grows much more slowly than bacteria. And then we have the mycoplasma culture. The mycoplasma culture is used when a specific type of bacteria called the mycoplasma is suspected. These bacteria don't have a cell wall, so they can be tricky to treat with regular antibiotics. Then we have the anaerobic culture. So we have some bacteria that thrive in oxygen-free environments. These are called anaerobes. And for infections caused by anaerobic bacteria, that can cause deep abscesses. An anaerobic culture is used to identify the bacteria and determine the right treatment. So when would your vet skip the culture? When your pet has a mild infection, like a simple UTI, urinary tract infection, and he or she is responding well to antibiotics, we might not need to do a culture straight away. However, if the infection persists or the symptoms get worse, even though they are on antibiotics, or worsen or persist, that's when we will turn to culture for a more targeted approach. Why does this matter? So by taking the time to identify the right bacteria or infection, we ensure that your pet gets the most effective treatment. This also prevents unnecessary antibiotic use, reducing the risk of antibiotic resistance. And this is a growing concern in both human and veterinary medicine. Using a culture or cytology is not about just treating the infection, but it's about ensuring that we're treating your pet in the most personalized way and effective way possible. And this way we avoid trial and error and experimenting with different antibiotics, which can sometimes lead to unwanted side effects. So as a pet parent, what questions should you be asking your vet? When you talk to your vet about antibiotics or infections, here are a few questions you should be asking. Number 1, what is the goal of treatment? And why would you want to do a culture or cytology in this case? Number 2, is there a possibility that my pet's infection could be resistant to common antibiotics? And number 3, what if my pet's infection isn't improving with the current antibiotics? When should I come back to you? After day 2, day 3? Should we consider a culture or cytology to identify the bacteria more accurately? And number 4, how long will it take for the culture or cytology results to come back? And what happens during that time? Do we treat with a trial, and what happens during that time? Don't be afraid to ask questions. The more informed you are, the better you can be an advocate for your pet's health. So if your pet is dealing with a recurrent or complicated infection, do not hesitate to ask your vet about getting a culture or a cytology. It could make all the difference in the treatment plan. So have you had a situation where a culture or cytology has been used to guide treatment? Drop your thoughts in the comment below. Don't forget to subscribe and hit the notification bell so you never miss out on our expert advice on pet care. Until next time, keep your pets healthy, happy. Goodbye.